Hello, this is Michelle from Physioactive Indonesia, bringing to you episode 14 of Singapore Surgeon Insight series. Today, joining us is Dr. Ong Kee Leong, orthopedic surgeon from Synergy Orthopedic Group Singapore. How are you, doctor?
I'm good. Thank you, Michelle, for the invitation. Glad to be here.
Thank you for taking the time to be with us. Doctor, can you start by telling us your qualifications and specialties?
Okay, I'm an orthopedic surgeon. My basic medical degree is from the National University of Singapore, the Bachelor of Medicine and Bachelor of Surgery. My fellowship, I'm a fellow of the Royal College of Surgeons of Edinburgh. I did a year-long fellowship in Germany, and basically I specialize in sports surgeries, specifically the shoulders and the knees.
Shoulder instability and dislocations are serious and often complex conditions that affect many individuals, from athletes to those in everyday life. Today, we'd like to dive deep into understanding shoulder instability, its causes, treatment options, and the recovery process. To start, can you explain what shoulder instability is and how it differs from a shoulder dislocation?
Okay. Thanks, Michelle. All right. I think the easiest way to explain would be to at least have an idea of the basic anatomy of the shoulder. So the shoulder basically is a ball and socket joint. You can imagine that this is the arm bone, and you can see that there is a ball at the top of this arm bone. So the ball basically will articulate and meet with the socket over here. All right. So it's like a ball and socket joint. That's how you have a very good and multi-directional rotation of the shoulder joint. Now, the shoulder joint is the most unstable shoulder of the entire body. The reason for that is simply because it is bound only by the ball and socket articulation as well as various muscle and soft tissue structures around the shoulder joint. It is not like, say, for example, the knee, which is a hinge joint, which confers significant amount of stability. So what happens is that if, let's say, a patient unfortunately injures the shoulder, it could be like, as Michelle, you rightly pointed out, maybe an athlete, maybe a racket player, and he swings his arm in a manner such that it causes a very awkward articulation of the shoulder joint. He can sometimes injure small structures within the shoulder joint. And this can cause injuries and tears, and that can cause some form of discomfort. Now, this kind of discomfort can range from pain. It can also go to instability. You can feel a sensation of looseness and clicking, and that can be a result of something torn and fraying within the structure of the shoulder. And this structure of the shoulder is known as the labrum in medical terms. In layman's term, can imagine it's like an O-ring or a rubber band in the socket, within the socket of the shoulder joint. And this can tear in various configuration and can cause different types of pain when the shoulder is moved through a various range of motion. Now, commonly, patients will have fallen on the shoulder, on the arm, and as they go into this kind of position, they will dislocate the shoulder sometimes, and this will be called a front dislocation. And when that happens, the patient could then have a sensation of instability. The shoulder is now disjointed. The patient straight away knows that there is something that is acutely wrong. The shoulder is out of its joint. That is a clear acute dislocation when the shoulder no longer is within that ball and socket configuration like this. It is out of the joint. So that is called a dislocation. However, instability, on the other hand, basically is just a term to indicate a general discomfort or condition where there is pain, there's clicking, and that is often due to an injury such as repetitive tears and movement of the labrum over here, or it could be due to that one-time bad dislocation that the patient has sustained when he went out like that. The shoulder joint went out like that, all right?
So, when a patient experiences their first shoulder dislocation, What are the initial treatment options? And how do you decide between a conservative treatment and a surgical intervention?
Okay, so that's a very good question because not all shoulder dislocations and the condition of shoulder instability requires surgery at the get-go. My preference basically is to see how bad the patient's discomfort is and what kind of patient level of activity he's actually at. Now, if it's a first-time dislocator, and the patient obviously will be usually in a lot of pain, my treatment will be that after we have already done a reduction, I assume the patient has already had the shoulder reduced back into the joint through perhaps seeing a doctor in the emergency department or seeing a
Mm-hmm.
general practitioner who has the experience and skills to put it back together. Usually, I must have had at least an X-ray to indicate that the shoulder is back in its original position. At the same time, this X-ray is also going to be useful to exclude any other more sinister problems, such as a fracture of the bones. If that has already been done, and I'm quite happy with the alignment of the shoulder, then treatment would consist of medication, initially pain relief medicine to reduce the pain, because he will be in a lot of pain still, even after the shoulder is put back into position. And then typically I'll put the patient on an arm sling so that the arm sling can help to provide further support to the painful shoulder. This pain usually will last for about 1 or 2 weeks. And certainly with medication, it will help to resolve the pain a bit faster. And coupled with it, I would normally have referred the patient to physiotherapy. All right. Now, physiotherapy is, in my opinion, very important simply because a lot of first-time dislocators, they have never had such a problem before. And what happens is that he wouldn't know what to do with such a shoulder pain, maybe even a feeling of swelling. He wouldn't know whether to move the shoulder or to just leave it as it is. So a good physiotherapist will be able to step in and help guide the patient to move the shoulder in a very careful and safe manner. Now, typically after about 1 week of pain medication to relieve the pain, I will usually refer the patient to the physiotherapist so that they can do things like pain relief modalities, ultrasound therapy, muscle tendon releases to ease the cramps as well as the spasms that the patient might have. And subsequently, when the patient is comfortable, right, with the help of medication, of course, we will start to range the patient in a very gradual and gentle manner. It will be uncomfortable at the beginning simply because it is barely only 1 week after a first time dislocation. But with good guidance and with the help of anti-inflammatory medications, typically, the range should slowly come back. And most of the time, I would expect if everything to be going smoothly, the patient should be able to regain full range of motion, hopefully by about somewhere between 2 to 6 weeks of physiotherapy. That's provided the patient is compliant to both medications as well as physiotherapy. He has to work very hard on a daily basis to be able to achieve this. Now, if let's say I were to follow the patient up further and he continues to have some discomfort, I will assess him and I will decide whether or not the patient is comfortable with his level of activity of his shoulder. Not all patients, as I said earlier, will require further surgical or invasive intervention. If the amount of range of motion is satisfactory to the patient, he's able to do his activities of daily living, that might just be enough for the patient, as long as he's comfortable. However, there are a separate group of patients who may have persistent dissatisfaction with the shoulder. That's purely because maybe the patient has a significant pre-morbid level of activity. He used to be able to play sports, he's able to play basketball, or he's able to even just do household chores like cleaning the windows, mopping the floor, and now the patient is unable to do so because he always gets this constant fear of the shoulder dislocating or so-called popping out. then I will explore with the patient the option of surgery.
Okay, so this would also apply if there is a continuous recurring of a shoulder dislocation, right, doctor?
Absolutely, yeah. So if let's say the patient is not having further problems of pain, of the feeling of looseness, of the fear that perhaps if he were to do a throwing action, typically like that, which is the most common fear of patients with anterior shoulder instability, this throwing action, because this is the most vulnerable position of the shoulder. If he has that kind of sensation that he can't do this well, and this is so important to him for his hobbies or for his activities of daily living, then if conservative physiotherapy has been unable to address this and improve this condition, that would be a case of recurrent instability that I would then explore with the patient further intervention.
Okay, so then can you walk us through the different surgical options available for treating the shoulder instability? And for Indonesian patients, what should their itinerary look like?
So there are quite a number of surgical procedures for shoulder instability depending on the actual structural damage to the shoulder. It can be a soft tissue damage purely, or it can sometimes be a bony damage. So I think I'm going to address mainly the soft tissue damage that is more commonly seen. This would usually be involving that rubber band-like structure called the labrum, which I mentioned to you earlier on, which is right in the socket, right down here. You can see that circular structure over here, like a O-ring. So sometimes when you have a dislocation, when a patient dislocates, this O-ring gets torn off its rim. So surgery is basically a keyhole surgery commonly, and we use keyhole techniques to pin this torn rubber band ring called the labrum back to its original position. So with that, the patient's stability will be restored and he can then safely embark on a period of rehabilitation to get back his range and his strength and back to his activities. Now, there are quite a few types of techniques involved for more complicated conditions that could include things like what we call remplissage. In very, very severe cases, we do a bone block transfer. That would be usually what I do is a Latarjet procedure, which is a more complex surgery for revision surgeries for patients who have had perhaps previous surgeries arthroscopically done to repair that soft tissue structure called the labrum. And unfortunately, he perhaps could have torn it again. And then this time round, we may have to move on to certain more complex surgery because the original soft tissue is unfortunately too poor to be fixed back again.
And what is the downtime for the surgery, doctor?
So going to downtime and patients' itinerary for patients who are in Indonesia. So typically, it's a period of about 3 to 6 months of post-op recovery and rehabilitation, depending on the patient's ability to be compliant to the physiotherapy, how active he was before the incident and before the surgery. So if I was to perform an operation, all right, for the patient for shoulder stabilization, typically I would hope that the patient is able to remain in Singapore for a period of about 2 weeks, simply because this is the period where I'm most concerned about things like infection. I'll be watching the wound very carefully just to make sure everything is nicely healing well without any signs of infection setting in. After 2 weeks, I'll be prepared to let the patient go back. During the first 2 weeks, I would have started the patient on physiotherapy. In fact, I get them on physiotherapy really early on the very first day after surgery. When he wakes up the next morning, after a good night's sleep, we get started so that we can get him moving. After the first day, I would then continue to engage the patient and then also at the same time make sure that he is compliant to the physiotherapy exercises. And at 2 weeks, when I say that he can go, I will make sure that the patient continues his rehab in Indonesia, making sure that he gets his range of motion up to the level that I want to. Typically, for most patients, up to the level of about 90 degrees, which is shoulder height. All right. And this is only going to be possible with the help of medication plus physiotherapy. These two has to go together. It cannot be one or the other, because if without one or the other, it will not progress efficiently. So this is something that I do tell patients all the time, that it has to be both at the same time. And at about the 6-week mark, that's when I will ask the patients to return, and I will then assess the patient, make sure that he's moving along at a good timeline. And if he is, and I expect him to be, then I'll make sure that he is able to progress from 6 weeks from shoulder height to above. And this will typically take another, well, it depends on person to person, about 4 to 6 weeks. So hopefully by 3 months, he will be hitting full range. During this period, for the faster patients, I will also have incorporated some strengthening exercises. I will have instructed the physiotherapists to begin some gentle strengthening exercises so that he can start to get muscle mass back already. So typically, from somewhere between the 3 months to the 6 months period will be when we are gaining strength, tidying up the range of motion, getting the full range, the end range, all that back. So at 6 months, he'll be hopefully going back to all his sports and activities already. That will be the in general. So some patients will be faster. Some patients will take a little bit longer. Maybe the older patients, the older folks, maybe a bit longer. But very, very important, 50% is the surgery, 50% is the physiotherapy. I think one important thing that I just want to highlight that I do see occasionally for those who are not so well aware of how to look after themselves after a shoulder dislocation or shoulder instability is the avoidance of having a frozen shoulder setting in. You will think that with a shoulder that's unstable, the last thing you will worry about is a shoulder that is stiff. But there are quite a few cases, unfortunately, who I do see is that after an injury, be it an actual full-blown dislocation, or perhaps just labral repetitive actions and then injuring the labrum and then get this pain, that I will also call it as instability because it involves the labrum structure, right? So whether it be pain or whether it be a sense of looseness, the patient unfortunately doesn't know what to do. So he just cradles it for maybe a good 4 to 6 weeks. Some of them I even see at 1 month, 2 months. Even I think the longest I've seen was like 3 months. And by the time they decide to do something about it, the shoulder is extremely stiff. So instead of an unstable shoulder, it's now an overly stiff shoulder. So that's actually a frozen shoulder, which is a painful, stiff shoulder. So then the problem is that we now have to get this range back for the shoulder. So I think it's very important that once a patient suffers an injury to the shoulder and there is pain or perhaps an instability, a dislocation, at least get it checked by a doctor, and then maybe get an X-ray bare minimum just to make sure that there's no fractures. And then usually, I think the first thing to start would be at least to get some medication and get the arm moving if there's no structural deficit that is going to cause harm. And the physiotherapist's role is very, very important in this manner because you really do need to get it moving so that you can avoid range of motion issues later on down the road.
All right. Dr. Ong, thank you so much for sharing your expertise with us today. Your insights into shoulder instability and dislocation have been incredibly informative, and we appreciate your time.
Thank you.
For our viewers, if you are interested in speaking with Dr. Ong, you can find details, including his WhatsApp, clinic phone number, and website in the description below. If you're planning to get your surgery in Singapore and live in Jakarta, you can start your physiotherapy at Physioactive Singapore and continue your rehabilitation program in Physioactive Indonesia. Please find details of our clinic below. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons. Thank you, Doctor.
Thank you.